So autism is a social, behavioral, and emotional disorder, and it has a range of symptoms from mild to much more severe.
So people with autism spectrum disorders will have challenges with communication, with social interactions, and with some stereotypical behaviors. So some of the challenges children with autism might have in terms of communication involve not being able to make great eye contact, not actually knowing the right words to use, and not being able to get their points across to the other person. There are lots of theories on what might cause autism, but we do think about it as a genetically based disorder that is not caused by anything in particular in the environment.
Autism is most commonly diagnosed around 2 to 3, but symptoms can be seen as early as 6 months.
My son Zachary was diagnosed with autism around the age of 3 years old. He used to attend play dates. However, even when I took him to play dates, he wouldn't really socialize with the other kids. You'd see him drifting off to the side. So it was like almost anything that I tried, I would still see another symptom pop up. And after a while, as you begin to put together the list of symptoms, I knew eventually what it was, but I didn't even want to call it autism at that time.
Pediatricians at every checkup that you go to will be observing and talking to you about maybe early signs of autism. Some of the things that pediatricians will be looking at, and you can look at home, that can be early signs of autism is if your child isn't babbling or pointing by age 1, no single words by age 16 months or 2-word phrases by age 2, they don't respond to their name when you call them, loss of language or social skills that previously they may have acquired. They make poor contact with you in terms of eye contact. And if you're starting to see certain repetitive patterns like excessive lining up of toys or objects, those can also be signs that your child may have autism. The real time in terms of actual objective questionnaire where we do screening is around 18 to 24 months of age. Your pediatrician should be giving you something called an MCHAT, which is a questionnaire that screens for autism.
So if you go to your well-child visit and the pediatrician has concerns, they might refer you to a psychologist to have a more comprehensive evaluation.
Treating autism is really going to be tailored to what deficits the child has and what milestones they need to try to meet. Behavioral strategies are really the first line approach.
At the very, very young age, there is something called early intervention that involves treatments like occupational therapy, speech therapy, sometimes physical therapy, that really address some of these symptoms of autism and help kids adjust.
A lot of children with autism also have some sensory processing deficits, so they might really struggle with specific textures or tactile sensations, and it kind of overwhelms them to the point of frustration or anger. So working to desensitize them from some of their sensory difficulties might also be really helpful.
So when they're a little bit older, they might be engaged in a type of therapy called ABA, or Applied Behavioral Analysis, that teaches almost sort of positive reinforcement for positive behavior.
When parents learn their children have autism, a lot of parents ask about their child's long-term kind of prognosis, or hey, is my child going to grow up to be, I hate using the word normal, but is my child going to grow up to have a normal, happy life? Is my child going to get married? Are they going to have friends? And we always try to reassure parents and say, we have seen some phenomenal outcomes with early intervention in children with autism. We've seen parents that are just blown away themselves by how well they do with their children.